Oh, my name is Dawn Stidham. I'm the nurse practitioner with cardiothoracic surgery, and this is Carrie Wheeler, our first assist and physician extender. We are going to briefly review removal of mediastinal chest tubes after open heart surgery. First, we'll take a look at what supplies that you need to gather. A chucks, some sterile gloves, ChloraPrep, suture removal kit, 4x4s and tape, also Vaseline gauze and chest tube clamps, and you should be wearing protective eyewear and a gown to protect your clothing from getting any bodily fluids on it. We are not going to do that for this video. So first, this is what the dressing will appear when you're looking at your patient. There may or may not be a dressing over this mid-sterile incision. That's just physician preference, but we put that there so that you could see it with the dressing in place. And then there's typically 2 mediastinal tubes just below the mid-sternal dressing. Also note there will a lot of times be a pleural chest tube in place, usually on the left lateral, and we will review that later. So once you gather all your supplies, you will want to remove the dressing from your patient's skin there. And we have 2 examples. This chest tube on the patient's left does not have a purse string suture to close the opening once it's removed. This chest tube on the patient's right does have a purse string suture in place that we will use to close the opening in the skin once the chest tube is removed. Especially if there is a purse string suture in place, you will want to do this with 2 people just because it's difficult to hold and tie at the same time. So we will first review the purse string suture removal, and you will always want to make sure you clamp your chest tube before you pull. So we have chest tube clamps here, and we'll put this underneath them just to kind of keep their bedding from getting messy. Open up your supplies. You'll want to have your 4x4s, your suture removal kit, and your prep opened. And if you are using for the purse string closure, we will not apply Vaseline gauze because the suture will close that incision. We will use Vaseline gauze on the chest tube that does not have the purse string suture closure.
And which physician uses the purse string?
They're going to both start using
Okay.
purse string. So Dr. Hart and Dr. Dudinsky will both use, but just there may still be an occasion where there, for whatever reason, is not a purse string closure. So just so that you're aware. You'll need to don sterile gloves, as you see Carrie doing, and clean down the tube and around the insertion site with ChloraPrep. And this looks a little bit different because we had to suture the purse string into a piece of gauze.
I do not want to get this prepping material onto the mannequin, so I'm just going to explain that I would put it on the site around the chest tube as well as on the chest tube itself, both underneath and on top. As best as you can, just cover both incision sites to clean the area before removal.
And you can warn the patient that that might burn for a few seconds, but it should go away quickly. Once the area is prepped, there's either tape or a steri strip that will be holding the sutures to the chest tube, and they are just kind of wrapped around, so you'll need to first unwrap the sutures.
there's already going to be one throw in the suture, so when you remove the chest tube and tie the suture down, it'll already be tied once to be able to close the hole quickly.
And you
So-
should leave that.
Correct. So I will hold that in one hand while applying pressure just to the top of the hole. So holding with these two fingers the string itself and applying pressure, downward pressure with the bottom of my hand, like so. And then holding the chest tube with the other hand, you can kind of get around it to the point where you can keep that pressure held and keep the pulling motion on the suture at the same time. You want to go through the breathing?
Yes, and if that's
Technique.
difficult, you can have two people so that you can concentrate on pulling the suture while the other nurse pulls the chest tube.
And in that case, I would be fully responsible for covering this hole, maybe with another piece of gauze with one hand and pulling up on the suture with the other. You want to do it that way?
Yeah, yeah. And then we will explain to the patient, we want the patient to not take a breath in while removing the chest tube. So just to make it, you want to make it as simple for them as possible to follow the directions. Have them take a big breath in, and a lot of times we'll do a practice round with them, so to make sure they understand. Take a big breath in, hold their breath and bear down, keep their mouth closed, and do not breathe in, and that's when we'll pull the tube. So go ahead and take a deep breath in and hold your breath, keep your mouth closed, and pull. And then we pull the chest tube out, and then you tell your patient that it's okay for them to breathe. This will not come off in real life. And then you'll see,
You just
if
kind
you're
of hold
doing
down
two
on that
people
for me.
here, I can hold pressure while she ties. And there is a tying technique that you'll see Carrie use, and it does take practice to learn how to quickly tie this down so that it locks.
So how many knots did you just do?
I do at least 4 or 5.
Okay.
But without that technique, you can just cross them over, flip a tail through, and then pull, just as if you were tying your shoelaces. Cross them over, pull a tail through, and pull. Just make sure you're getting it down nice and tight and snug, and making sure that that hole is staying closed. And the person that's holding the pressure can help keep that hole closed while you're tying. Just make sure that the knot comes down fully and completely. And then, again, just 4 or 5 knots. And then cut
What happens if you get it too tight?
too tight. It can actually cut into the skin. So if, say, it becomes too tight to the point where it's going to affect the skin, or if you get an air knot and are unable to tie it down completely, you can just remove that stitch, but we ask that you do use Vaseline gauze to close the hole. It happens. We don't want it to, but it does. Just make sure that you put some sort of seal on that hole. So typically, if we have a suture like this in, it's because it's either a larger hole or it is, you know, a reason for wanting to keep the hole closed. So, and the other one.
And then again, no Vaseline gauze on that, and then you would just put a piece of gauze and tape over it. Now this chest tube does not have a purse string closure, so we're going to go through the same things. And the assistant should have on sterile gloves as well. I realized I didn't when I was helping Carrie, but okay. So again, you'll take your ChloraPrep and clean off down the tubing on all sides and on the skin around the insertion site. The dressing has been removed, and you will want to get a piece of Vaseline gauze and a piece of regular dry gauze to put on over that site. You'll then go through the same breathing instructions, and you can do this with 2 people or 1. And I usually hold it there right away, and then another person can be there to kind of just make sure that is closed. So you'll have the patient taking a big breath and hold it. Make sure they keep their mouth closed and do not suck any air in. So 1, 2, 3, take a big breath in and hold your breath and pull. And you immediately apply that Vaseline gauze to the site, and then we can put a dressing over the entire thing. Now, one thing to be mindful of, if you do not have a dressing covering your midsternal incision, you don't want to put this tape right over that surgical incision. So sometimes you have to kind of make a cut in the tape to keep it off of that incision site. Yeah, we typically will pre-medicate before pulling chest tubes, just to make it more comfortable for the patient, because it is kind of painful. And we have spoken with Dr. Hart and Dudinsky, and you'll need an order to pull the tubes. However, just for a general idea, they have said if there is less than 150 mLs of fluid in the chest tube between midnight and 8 a.m., they want the patient to get up, sit in the chair, walk around, and if there is still less than 100 mLs by noon, then the chest tubes can be removed. But they want to make sure that they get up, walk around, and they don't dump a lot of fluid into the chest tube. And the reasoning, basically, we just need to make sure that they're not going to continue to accumulate fluid in that space and then return to the office and need with a pleural effusion and need to have a thoracentesis. So we want to avoid, further procedures for the patient, but we also want to get the tubes out as soon as possible to make it easier for them to get up and move around and control their pain. And that's it. Thank you.